Thank you. Minister, moving to medicinal cannabis, under the Controlled Access Scheme to Medicinal Cannabis in Tasmania, any patient seeking to access medicinal cannabis must be referred to a specialist who must then make an application to the health department for assessment by a multidisciplinary expert panel of clinicians. There was a Senate Community Affairs References Committee and they released their report in March 2020 called Current Barriers to Patient Access to Medicinal Cannabis in Australia. A key recommendation from that report was that GPs in Tasmania should be permitted to prescribe medicinal cannabis in line with other jurisdictions without the need for further approvals. I should just note we are the only state with the dubious infamy of being singled out in this report. So, Minister, why has Tasmania chosen to continue with this incredibly burdensome and bureaucratic process that requires a patient to two medical professionals to make a referral and then a further assessment by a multidisciplinary expert panel of clinicians in the department?
Thank you for the question. With regards to our controlled access scheme, this has been set up to ensure that Tasmanians are enabled to access medicinal cannabis products in a safe and clinically sound setting. The CAS is specifically designed to support the safe and appropriate use of unproven medicinal cannabis products through a rigorous assessment of applications informed by evidence and expert clinical advice. To protect patient safety, Tasmania's scheme requires that standard evidence-based treatments be exhausted before any unproven or unregistered medical cannabis is tried. The Tasmanian government is the only government in Australia to subsidise the cost of highly expensive medical cannabis products and make their potential benefits accessible to Tasmanians, not just those who can afford to pay. I'll continue to support the judgment of our specialist clinicians, and I'll always take advice from the experts with regards to this matter. My advice is that with regards to the controlled access scheme that has been implemented, we have support of the AMA, RECGP Tasmania, as well as Epilepsy Tasmania on the mechanism of our scheme. With regards to this, I will continue to make sure that we look at all current available evidence and make decisions based on that.
Can you tell me how many times the recommendation, the multidisciplinary expert panel has rejected an application that was recommended by the treating health professional?
I'll see what, Dale. We have at the table now Deputy Secretary Dale Webster, who's the Deputy Secretary of Community Mental Health and Wellbeing. I'll get Mr Webster to provide that further detail.
Thank you, Minister, and through you. And just a moment while I get my screen to work. Apologies. I've gone to meningococcal.
Happy to ask another question while you find it and we can come back to it.
Paper.
You said it to me earlier.
Thanks. Since November 17, there have been 17 applications approved for 16 patients, and there have been 39 applications submitted by a relevant medical specialist for 28 patients, as I said, resulting in 17 approvals for 16 patients.
Sorry, can you say that more slowly, that last
sentence? So 39 applications submitted by a relevant medical specialist for 28 patients, resulting in 17 approvals for 16 patients.
Does that mean that in 22 of those times they were rejected?
Not rejected. They are sent back if there are other appropriate medications, etc., that need to be trialled and clinically acceptable, then advice is given back. So the applications generally are not rejected, they are sent back for further assessment for other clinical pathways.
From the patient's point of view, that would be a rejection. All right, thank you.
Thank you, Chair.
I'll give the call to
Yeah.
Ms. Dr. Woodruff.
Thanks, Chair. Minister, the Senate committee report in current barriers to patient access to medicinal cannabis in Australia, March 2020, states that the Tasmanian government made a sovereign choice not to take part in the streamlined access process that was agreed to by COAG health ministers in April 2018. To be clear, Tasmania is the only state that has not agreed to participate in the Special Access Scheme for medicinal cannabis through the National Therapeutic Goods Administration. It was further reported in that Senate report that the Federal Minister for Health, Mr. Greg Hunt, has committed, quote, committed to continue to raise the issue of medicinal cannabis access in Tasmania, in his quotes, at every opportunity he has. Minister, can you confirm that you're being lobbied by the Federal Health Minister, Greg Hunt, to adopt the streamlined access process that was agreed to by COAG in 2018?
So Minister Hunt and I have a range of conversations about a range of matters. I'm not going to go the conversations that Greg Hunt and I have. In terms of our states, the mechanism that we do have, I do acknowledge that the Tasmanian government is the only government in Australia to subsidise the cost of highly expensive medical cannabis products. The process I have outlined in a previous question, and the Deputy Secretary has provided data on that. I also said in my previous answer that we'll continue to monitor this situation. The CAS, or the Controlled Access Scheme, obviously this was stood up prior to me being Minister, and my advice is, as I said in my previous question, that the model that we have here in Tasmania is supported by the AMA, RACGP Tasmania, as well as Epilepsy Tasmania. So I can assure you that we'll continue to engage with experts in this area to ensure that we are always taking learnings on board with regards to access to medical products, but I'm not going to preempt the future.
But Minister, can you understand that suffering patients, families with suffering children don't want a handout. They don't want free medicinal cannabis. If we're the only state, if that's the reason for holding back on allowing access, people don't want that. They just want the access. Now, a person living in any other state in Australia is able to access medicinal cannabis through one system, through the Therapeutic Goods Administration. This government in Tasmania is blocking the right of suffering patients to be able to access medicinal cannabis. Can you consider how important it is to reverse this decision, which we've been sticking to? I assumed it was because of the previous health minister. You have the opportunity to make a huge difference in people's lives. It's all very well having a system that is resourced, but if no one ever gets approved to use it, it costs effectively nothing. So people don't want the free drugs. They want access to the drugs that anyone else in Australia could get for the same condition. Will you change the system that we've got and move to the rest of Australia?
So my advice is that we have got a clinically appropriate system. The system that was stood up, I'm advised, was based on clinical advice.
Can I respectfully ask you to get some other advice and to listen to the medical practitioners in every other state of Australia who have got on board with this? So for some reason, our AMA, RACGP, they are out of step with the rest of the country. And can I suggest that you look into that, please, as a matter of priority for patients who are desperate, like Lynn Cleaver and her son. It is really painful hearing these stories and having no change year on year. It's something you can do something about.
I acknowledge that we have people in Tasmania that, because of their conditions, have an enormous amount of suffering. We work really hard to be able to support them. As I said in my previous answer, Dr. Woodruff, I'll continue to take advice from the professionals in this space. We know that there continues to be a lot of research done in this area, and I'll continue to take the advice of experts. I can't preempt what the future will be, but what I can say is we'll continue to do that, because I don't think anybody wants to see Tasmanians suffering unnecessarily, and so that's why.
You're the
But
one
I
who can do
continue-
something about that.
But I continue to take
You're in
the Minister
charge.
for Health the role very seriously. I know that these are very complex matters, and the conditions that some Tasmanians suffer from are very complex. I take advice from the experts with regards to that. As I've outlined, the position is supported by a number of stakeholder groups, and I'll continue to engage with them. And I commit to you, Dr. Woodruff, that I'll continue to engage in an open way about this matter.
And with your Federal Health Minister. He's trying to change your mind. Thank you, Chair.